Hello and welcome. I'm Dr. Paul Beckham from All Seasons Integrative Health in Fargo, North Dakota. And this is day 4 of our reverse neuropathy presentation. Today, we're going to be speaking about advanced therapies for neuropathy treatment. Again, let's go and give you a brief kind of review here. What is neuropathy? Neuropathy is when you start to lose the proper circulation that goes to your nerves. Then you start to develop sensory signs that could be unusual sensations. I've had people describe it as, they feel like their sock is balled up underneath their foot, or their feet feel like hamburger. Some people have just pain to very light touch, uh, burning, numbness, tingling, and then that's going to start to develop into balance problems because people aren't able to feel their feet. But this can also happen in your hands. The next thing that could happen is just motor nerve damage, where you'll get, muscle cramping. You could get twitching of the muscles there, and if we're doing an exam, we can even find some reflex abnormalities, and that could be, in your upper extremities or lower extremities. Other things that could happen are autonomic nerve damage, where you'll start to excessively sweat. You'll maybe have some heat intolerance. You go outside and you just can't handle it. It's too hot. Uh, you can feel like you just get full quickly because you'll get a little bit of gastroparesis possibly. So any kind of food that you eat just feels like it kind of sits in your stomach. Impotence, you know, for men, that might be a big thing here, and spur you on to look at getting some kind of treatment for things. And it might really boil down to that you really have neuropathy going on. You could also have orthostatic hypotension, meaning you can go from a seated to a standing position, get a little bit dizzy, or from laying down to even just sitting up in bed. Again, what causes some of the risk factors here could be, medications, could be that you're deficient in certain vitamins. A lot of the medications do cause deficiency in some of the vitamins there. Alcohol can cause deficiency in vitamins, which then can bring on neuropathy here. Diabetes is probably the number one situation where people will start to develop neuropathy. That's not all of them, but that is some of them there. Autoimmune diseases, like we've talked about before, lupus, rheumatoid arthritis. But today we're going to talk about the advanced therapies for neuropathy. First of all, we have our laser therapy. And laser therapy, as you can kind of see in the diagram here, helps with angiogenesis and neovascularization. So it's regrowing blood vessels, and especially to the nerves, which are starting to be affected and causing neuropathy to be going on. Laser also helps with collagen production, so helping to regrow some of the tissues. It even helps to regenerate muscle, and especially if the muscle's been atrophied because of that long-term, you know, decreased blood flow that's getting to the nerves. It also helps decrease inflammation and edema. It'll help even regrow or regenerate the nerves. So if the nerves are damaged, it's possible that we can even help get some of that back. So even some of the patients that are off on the, critical or extreme end of the spectrum, we can get some of those nerves back. We might not be able to get all of it, but we can get some of it back. And again, we'll be doing the testing on that sensory and motor and autonomic systems to make sure that we are getting progress for everybody. Again, cartilage production, the laser helps with, and bone formation. Patients here, like we have Barry here, who, he hasn't worn his shoes that he typically wore before he was really affected by neuropathy, and is now able to wear his shoes, in the last 6 months, where he hadn't been able to wear them just because of the pain and inflammation that was going on in his feet. Then we have shockwave therapy. Shockwave therapy here, again, it's a focused shockwave that actually helps to even regrow some of the connective tissue. It helps to even decrease pain and inflammation as well. It's helpful in a lot of conditions here, again, but with neuropathy here, it's super helpful in getting that inflammation kind of calm down. That's occurring in people's hands and feet. And again, another testimonial here. You got a patient, even with 1 month of therapy here, is already doing significantly better. So, is everybody going to get better in that first month? A lot of people, it's a slow slog, depending on, where you are on that spectrum and how well you adhere and do, your therapies, your nutrition, your home therapy, all of it. If we get it all worked together, depending on what you need, uh, the more of it that you're going to do, the better results you're going to get. Pulse electromagnetic field therapy, PMF therapy. Typically we have people sitting in a chair and we're running certain frequencies there, because if they're doing their home therapy, the home electric stim therapy is very similar to the frequencies that our PEMF gives off in the office. So we tend to run frequencies that are kind of above and below that help deal with other things like inflammation, even detoxing the system there, or more focused on the nerves to help the nerves kind of calm and soothe. Whereas the therapy for home helps to just normalize that nerve function there. Again, here's all the things that it helps with. PEMF originally was developed to help heal non-union fractures there. It was also was developed to help heal diabetic, wounds that just weren't healing there. So it's going to help basically put a charge on your body's cells so that they can function normally here. And then it especially helps out with blood circulation. Again, another patient here, they went from 37 and 40% sensory loss down to 13 and 0 this was over a 90-day period of time. So got some significant improvement there. Again, the nutritional support, we look at it more from a functional medicine standpoint. A lot of times, all the symptoms are like the leaves on the tree here, and we don't just want to treat the symptoms. We want to get down and find the root cause of the problem here. So, is there some nutritional deficiencies? Is there some stress, whether it be chemical, mental, or physical stress on your body? Are there some genetic things going on? There's some really good nutrigenomic tests that we can do now that can give us a really good idea of just genetically where you might have some weaknesses, where we can enhance that by making sure that you're either eating certain foods or taking certain supplements to help out with that. You just have poor digestion overall. And sometimes that's where we get into this gut health over here with Zara. Poor digestion just ends up causing inflammation, chronic systemic inflammation in your body, because you're not breaking down the foods that you're even eating. So if we get this cleared up here, and that's where a lot of the patients that come into the office, it's a high percentage of them. I would say over 80% of the neuropathy patients that come in do need some gut health or metabolic support. And if we can get that done at the same time when we're doing either the in clinic or you're doing the at home and nutritional protocols here, you're going to heal that much faster. Just lack of sleep. So getting yourself on a good sleep schedule. I tell people, instead of going to bed and using an alarm clock to wake up, have an alarm clock so that you go to bed on time, the same time every night. And I think you'll find that makes just a world of difference in doing that. Other things that can feed into things, any past traumas that you might have had, medications, GMO stuff, anything that's genetically modified foods, infections that you've had, or toxins, different things that could have been going on here that we can, literally get addressed by, again, a detox program, a metabolic program to help clear this stuff out of your system so you can heal and do better here. The middle picture here is, how functional medicine is going to look at your life, the 7 different areas, as well as the 4 different external factors that can affect your body. Zara here had done really well. Even within 45 days, she lost 20 pounds. I think after her program was 75 days long there, she was down over 30 pounds. I want to say over 35 pounds. And that was not a diet. It was just getting her to eat healthy and taking the nutrients that help decrease the inflammation in her body. So we want to integrate these therapies for the best results. That's why we have a comprehensive, multifaceted approach for treating neuropathy here. We want to make sure we're dealing with all the different components, the sensory, the motor or muscle aspect of it, as well as any kind of autonomic thing that might be going on, so that we can get you the best results you possibly can get here, and hopefully get you back down to, we're probably not going to get you down to zero, but to the point where you're in a normal range where most people might be at. So, and, as we combine these things together, they almost have what's called a synergistic effect. It's not just 1 + 1 = 2. It's more like 1 + 1 = 3, and they just keep multiplying there. So depending on what we need to be doing here, the better results we typically are going to see with our patients. And just personalized treatments. Everybody's going to get tailored therapies that are going to be individually for what they need, dependent upon your severity level there. And you'll always get to choose what you want to do for treatment here. We're not going to force you into doing any kind of treatment. You are always in control of your own health. So we're always going to be doing continuous assessments. Typically during that first 90 days, we're going to be measuring once a month. And then after that, if you still have something going on or you don't, we're going to get you measured about 3 months out again. And then we'll start about every 6 months, just following you for a while till we can maybe back it off to once a year. Another success story here with the patient. She's been doing the gut health program, and like she says here, just feels better. She's had less acid reflux. She's had more energy because she's digesting the foods that she's been eating. There's great daily recipes. There's an online component to this, so you get recipes on a daily basis here, so you can eat some different foods or take the foods or the recommended food items in the anti-inflammatory type diet and make some really good, healthy, tasty meals with it. And she thought it would be hard to stick to, but it's literally like a shake. It's basically almost a meal replacement in the morning when you add on that metabolic or gut health program. But it also then, like I say, is just helping decrease that inflammation in the body. We talked about this before here. We want to get, as many people, if you're at that 37, 40%, sensory loss there, get you down as close to that zero. In this case, we did get somebody to zero, but 13 on the other side. Usually anytime we get underneath 15, we're doing great. If you have any questions, please, respond to this video presentation here, and we'll try and get those questions answered for you. Because if you're having questions, somebody else probably has those questions as well. So there's really no dumb question. And, we'll make sure that we even get that possibly addressed in the future here in other videos that we, either have in line or, we'll have to add on in the end. So again, hey, the benefits of these advanced therapies for neuropathy treatment, they work, and depending on what you need, we're going to give you, here's the best results or the best therapies to get the best results for you here. And, we'll let you know how long it's going to take, what it's going to cost. So this stuff ahead of time. And that way there's no surprises. Again, you get to choose what you want to do. You could choose just to do the nutrition. Might not give you the best results there, but maybe that's all you can afford. You might choose to do the nutrition and the home therapy, or you want to do all of it, or just do the nutrition and in clinic. We've had that with some patients. They know they're not going to have time to do stuff at home, so they just come in and get their treatments done in the office and just do the nutrition at home. So if you want to book a consultation, all you need to do is, go to our website. I think the easiest thing to do is just to go to fargopn.com, and that'll take you right to our neuropathy page. Otherwise, you can call 701-356-0016, and they'll get you set up for that initial consultation there. We are currently running some special offers here. Don't know how long they'll last, but you can always come in for a free workshop. So say you have more questions or something like that, you can come into that workshop. During the workshop, we're going to go over everything in the office, from the evaluations to the treatments, and, as far as the in-clinic treatments, at-home treatments, the nutrition and diet programs that kind of go along with the whole thing here, and answer any questions that people have. If you feel like you're just ready, you want to get going on something, then you can come in for that consultation, our initial consultation. We do charge $49 for that right now. Um, and during that, we're going to be able to tell you, the severity of it, so we can give you a pretty good ballpark of what we're really looking at here. And as far as even maybe not cost, maybe we'll give you a range there. But we'll also give you the severity of where it's at, and you know what you need to do here to kind of move forward, because then we need to complete the rest of the exam so that we can literally determine everything that's affected there. So is your autonomic nervous system affected, motor, sensory, and just exactly what do we need to do here to get this treated so that you can finally feel good and live your full potential. So our next topic is going to be, the role of nutrition and lifestyle changes in managing neuropathy. So there we'll get into a little bit more of the diet and nutrition that go along with this. So you should hopefully have a little bit better idea of what that's all going to entail. So please follow our page, on Facebook there. You can also go out to our website, and, there's going to be health tips posted on Facebook. And we do post some things on our blog on a fairly regular basis as well. So I hope this information helps. And, if you do have neuropathy going on, or you want to find out if you do, again, we'll hopefully see you soon in the future here. If not, have a great day.